Hi, my name's Sarah Heenan, and I am a nurse practitioner student going to be doing a focused neurological exam. So I'll provide hand hygiene and privacy to the patient. My patient is a 23-year-old Caucasian male, and he appears appropriate dressed, dressed for the age, culture, gender, and weather. I am going to introduce myself and ask orientation questions. Hi, my name's Sarah. I'm going to be doing a neuro exam today. Can you tell me your full name?
Nathan Foster.
And what's your date of birth?
03/01/95.
What's the year?
2018.
Okay, good. And then where are you right now?
Doctor's office.
And why are you here?
I have a headache.
Okay, so patient's alert and oriented ×4 to person, place, time, and situation. Just by speaking with the patient, I can tell that he is alert. He is he's mentally appropriate and answers questions appropriately. So next I'm going to ask questions for the history of present illness. So when did your headache start?
This morning.
This morning? About how long ago?
5 hours.
5 hours? Okay. And was it a sudden onset or gradual?
Sudden.
Sudden onset. And where is the headache on your head?
Right side.
Right side only, not on the left side at all. So it's unilateral. And then duration, you said it's been going on for 4 to 5 hours. Okay. And then how would you describe the pain?
Kind of like a pulsing, throbbing feeling in my head.
Okay, so pulsating, throbbing feeling for the character. And then anything make it better?
I laid down earlier, turned the lights off.
That helped. Okay, did you take any medicine for it?
Ibuprofen.
Okay, and that did it seem to help? No? And then anything make it worse?
Light, bright lights, loud sounds.
Okay, so he's experiencing photophobia and phonophobia. And then does it radiate anywhere in your head?
My eye, the back of my right eye.
Okay, so it starts on the right side and radiates to the eye. And then timing, anything happened around the time that it started? What was going on before? Did you hit your head on anything?
No,
Any head trauma?
I lost my vision.
You did lose vision before the pain started?
Yeah.
How long did that last?
15 minutes.
15 minutes, okay. Anything else happen before? Any precipitating factors other than the vision loss? Okay, no trauma, you said, to your head. Okay. Severity, so on a scale of 0 to 10, how bad's the pain? 8, okay. And then any other associated factors besides the vision loss? Any nausea, vomiting?
I threw up on the way here.
You did, okay. So 1 episode of emesis, and then are you nauseous now? Nausea, okay. Any medical history for you?
I've experienced this once before.
Have you? Okay. How long ago was that?
8 years.
Okay. And then any other medical history?
Seasonal allergies.
Okay. Any surgical history? Any surgeries?
I had my wrist done.
Okay. And when was that?
2014.
Okay. So wrist surgery in 2014. Any other surgeries? Any hospitalizations?
Nope.
No. Okay. Any medicines that you take daily?
Yeah, daily I take Allegra, a daily vitamin.
And you took ibuprofen today? And that's it? No other medicines?
No.
What milligrams for your Allegra?
180 in my Allegra, and I took 800 today of ibuprofen.
Okay, and you took all 3 of those today, this morning, and it's just once daily?
Yeah.
Okay, and then any allergies besides seasonal allergies? Any allergies to medications?
Nope.
So no known drug allergies. And then family history, so just immediate family, parents, siblings, kids, any heart disease, any stroke, any diabetes, any significant medical history for them. They're healthy and alive? Okay, good. And then we'll do social history. So do you do any drugs?
No.
Any tobacco use?
No.
Any alcohol use?
Just on the weekends.
How many drinks do you have on the weekends?
1 or 2.
1 or 2. Okay. And then what do you do for a living? Do you work?
I'm a mechanic.
You're a mechanic. Okay. So do you go to school?
Part-time, yeah.
Part-time. And then do you have any other activities that you participate in?
Just golf, I work out.
Okay. So you kind of have a lot going on. Do you think stress was maybe a precipitating factor? Going back to our timing question, you think you have a lot of stress going on right now?
For sure.
Okay, so that could be a precipitating factor going back. So with your chief complaint of having a bad headache, we're going to do a review of systems. So I'll start with general, so any weight gain, weight loss, any weakness or fatigue, any fever. Okay, no fever. And then we're just going to do focused, so I'll do the neuro, eyes, and GI, since those are kind of the issues you're having. Eyes, any other vision problems before this? No, just the 15 minutes of loss of vision, and that happened with your previous episode of this? And you thought it was a migraine that time? Okay. And then any blurry vision, double vision, no visual changes, any glasses or contacts that you wear? No? Okay. So no other issues there. Neurologically, you said there was no trauma, you didn't hit your head or anything that you remember. No memory changes, no trouble remembering anything, nothing. Okay. And then GI, you said you are having nausea, vomiting. You vomited once. Any other symptoms? Diarrhea, constipation, any abdominal pain? Nothing else that I'm missing? No other signs or symptoms that have been going on? Okay. So next I'm going to start with the physical exam. So I'm going to do cranial nerve 1, which is olfactory. So I'm going to have you occlude one side of your nostril and breathe, and then do the other one. Cranial nerve 1 is intact. Cranial nerve 2 is the optic cranial nerve, and I would get a Snellen chart and place it 20 feet away from the patient, have them close one eye, read the chart, have them close the other eye, and read as far down as he can go, and then do both eyes the same way. And I would check for visual acuity, and to save time, I'm not going to do that this time. Next, I'm going to shine a bright light in the patient's eye for ocular motor cranial nerve 3, to check for pupil constriction and responses. So pupils are equal, round, and reactive to light, and they're about in accommodation, and they are 4 millimeters bilaterally. And then to test cranial nerve 3, which is oculomotor, 4, which is trochlear, and then 6, which is abducens, I am going to do the 6 cardinal gazes and check extraocular function. Lost my pen, but I'll have you just follow my finger with your eyes, and I'm looking for nystagmus, any shaking of the eyes with these fast and slow movements. I'm asking the patient if he has any diplopia, so any double vision when we do this. No double vision, and then any ptosis, any eye drooping. So cranial nerves 3, 4, and 6 are intact. Cranial nerve 5 is the trigeminal, so I'm going to test motor and sensory. So I'm going to have you clench your jaw and then move your jaw side to side with it open. Okay, and cranial nerve 5 motor is intact. And then I'm going to check cranial nerve 5 trigeminal with sensory. So I'm going to have you close your eyes, keep them closed, and tell me if you feel a sharp or dull sensation.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay, so cranial nerve 5 is intact. We did cranial nerve 6, which was abducens, and then cranial nerve 7 is facial. So I'm going to have you smile, raise your eyebrows, puff out your cheeks, frown. Okay, so face is symmetrical from left to right. Cranial nerve 7 is intact. Cranial nerve 8 is hearing, so it's vestibular and auditory. And so I'm going to do the whisper test. So I'll have him occlude his contralateral ear, and I'm going to whisper a number, and he repeats it back to me.
88.
And then I would do the other thing, the same on the other side. I could also test for air and bone conduction, but I don't have the tools for that, so we'll skip that for now. So cranial nerve 8 is intact. Cranial nerve 9 is glossopharyngeal, and 10 is vagus. And I'm going to have you open your mouth and look at me and say, And I'm looking at the uvula, and it is midline, and there's no deviation. The pharynx and the soft palate are symmetrical and intact. I could check gag reflex for the vagus cranial nerve, but 9 and 10 are intact. 11 is spinal accessory, so I'm going to test sternocleidomastoid strength, and then I'm checking for any fasciculations in the trapezius muscles and doing shoulder shrug resistance, which is strong and equal. And then lastly, I'm going to do the hypoglossal, which is stick out your tongue, move your tongue side to side. There's no atrophy. Tongue is symmetrical. And I'm going to have you push on the outside of your cheek with your tongue, and it's strong bilaterally. So cranial nerves 1 through 12 are intact. Next, I'm going to check motor. I'm going to check your gait. So if you'll just stand up and walk normally. So arms are swinging side by side. He's got normal coordination and balance. Heel to toe. We'll check tandem walk, and he seems to have normal balance. He's not off balance. And then on your toes, so I'll have you walk back and forth, and then on your heels. Perfect. Okay, so balance and coordination is intact. I'm going to check coordination with fast movements. So I'm going to have you rotate as fast as you can, and then I'm going to have you do your finger movements here and tap your toes as fast as you can simultaneously, and those are both normal and intact. And then I'm going to have you touch your nose and then touch my finger. And he has good coordination with that. And then lastly, I'm going to check muscle strength. So I'm going to have you do shoulder abduction, pushing against me, and that's intact. I'm going to have you do elbow extension, and then I'm going to have you do wrist extension, push up against my hands, good. And then finger abduction, strong and equal bilaterally. Then I'm going to have you do hip flexion, so push up against bilaterally, strong. And then I'm going to have you do knee flexion, so pull against my hands. And then if you can see, we'll do feet dorsiflexion, so push up against my hands. Good. And I'm trying to think if I missed anything. Okay, I think we checked everything. So now for my differential diagnoses, I'm going to focus probably on migraine as my number one diagnosis, just because he's had a history of a migraine before. A lot of the symptoms that he's having, he has nausea, vomiting, it's unilateral, it radiates forward to the eyes, it's not on both sides, and he's having phonophobia, so it sounds very similar to a migraine. But I also want to talk about some other differential diagnoses that I want to consider and definitely rule out with my exam and maybe some further testing. So definitely a subarachnoid hemorrhage would be the big, bad, and scary one that I would want to rule out. So that's a sudden onset, usually like a first. They've never had a headache like this before. It's the worst headache of their life. It's unilateral usually, and so this kind of presents as that as well. It's a severe headache, so I definitely want to rule that out. I could look at a transient ischemic stroke. Meningitis would be kind of one of my first thoughts, but then with no fever, and then with the history and the physical exam, I don't think that meningitis would be one, but it could definitely be one to consider. And then also I could look at like a brain tumor or another mass that could possibly be in the brain, and that could cause a unilateral pain as well, but possibly would have some more neurological deficits than a migraine, which he didn't have any. All his cranial nerves were intact. Everything else seemed to be intact besides the history portion that he was telling me. So I think that's it. Thank you.